of course, I'm going to explain how do they happen as well. So direct and indirect reflex, this is basically when you shine light on one eye, the pupil will constrict, will become small. But it will constrict on the eye that you shined some light on, so ipsilateral, and also the other eye as well. So the ipsilateral constriction of the eye that you shine some light on is called, so direct reflex, it's constriction of the pupil on the eye which the light is shown. And the consensual right reflex is the constriction of the opposite pupil, even though no light fell on that eye. So this is a direct and a consensual light reflex. So let's talk about the pathway of the visual reflex. The direct and the consensual right reflex goes at the following. It all starts from the optic nerve and then goes to the optic chiasm, and after that will go to the optic tract. And then it will go to something called the pretectal nucleus, which is present in the midbrain. The pretectal nucleus, just very close to the superior colliculus. This should be covered in the midbrain. And then the impulse will come from the pretectal nucleus to a parasympathetic fibers of Edinger vestibule nuclei. This is of the third nerve. Remember when we talked earlier that 1973, right, is parasympathetic. So here you want to go parasympathetic of the third cranial nerve. The fibers will stay, and it's called the parasympathetic nerve fibers, and then travel through the third cranial nerve, which is the oculomotor nerve, to the ciliary ganglion. The postganglionic fibers will come through the short ciliary nerve